All right, everyone, time for our next session. We are going to hear from Johnny from our partners Accelerate Recruitment, and they are another recruiting partner, of course. So please do take it away, Johnny. I am going to spotlight you and feel free to go ahead.
Thanks, Nikki. Hi, everyone, and thank you for putting this together for all of us to be able to come on here and share. Great to see Paul and the other attendees, Gustav as well. Great to see you guys as well. So I'll kind of take it away. I'm going to share my screen, share a couple of slides, and also share a demo. I know that there were some questions on the chat regarding some IRB approval stuff, so it'll be a good segue for me to touch base on that based on what we do. So let me go ahead and share my screen. Hopefully you guys are able to see that. So here at Accelerate Recruitment, we didn't reinvent the wheel when it comes to our actual recruitment process and how we integrate with CRIO. I'll share a little bit about what we do and then our integration and how powerful it is. So what we like to do is we like to allow the sites or the sponsors to take control of the recruitment process hands-on. So we attract potentials, and I'll kind of show you what we do in terms of the ad work. We obtain those qualified fresh referrals, which is very important. We don't like to recycle leads. Doing clinical research for over 20 years, we've come to the conclusion that more often than not, recycling leads eventually leads to just a backlog of potential subjects that are simply participating in a study because they want to participate in the study due to the whatever they may be getting out of it rather than trying to find a solution for their condition. And we're allowing you to also automate all of your communications, monitor any aspects of the recruitment, allowing the sponsor to also have visibility. So go ahead and go next. So how are we maximizing your exposure? So we do everything that we do, everything that is patient facing needs to be IRB approved. So I know again that there were some questions in the chat regarding IRB approval marketing materials. Anything that is related to recruiting that a patient is going to see, hear, or read has to be IRB approved. There are some instances in which you can get away with it if the information is very broad, but it's usually not a risk the sponsor likes to run into. They definitely don't want to get a notice. So more often than not, if you're questioning whether or not this should be IRB approved, just get it IRB approved to be on the safe side. So everything that we do is IRB approved, is compliant with the IRB, reviewed by the sponsor at the site level, at the sponsor level, and then at the IRB level before it gets published. So we do create an IRB approval package at the initial phases. And then these are some examples of the ads that individuals are seeing as they are potentially searching or they're in Meta, whether it is Facebook, Instagram, whether they're on TikTok, Hulu, whatever the case may be, Google. These are some of the ad examples that we create and they are able to see. And then how are we generating these pre-screened potential subjects? So they're coming off of a custom landing page that we create specific to the study. And based on the pre-screener questionnaire, which it's rule-based, then they could eventually either qualify, not qualify. From there, they're transferred over to TrueView, which is where the magic happens with CRIO. So let me briefly go ahead and show you. Again, these are some of the ads that you are able to run into as you're potentially have searched or have the condition. This is what the IRB approval package that we create looks like. So it has the landing page, the information on the landing page, mobile and desktop version, any text that is included in the landing page. Again, any information that is related to the study that is patient or referral phasing needs to be IRB approved. Same thing with any images. These are all the images that essentially are recycled through the campaign. The pre-screener form, which essentially goes through exclusion and inclusion criteria that will either qualify or disqualify the potential participant. And as they go through the screen, we use conditional logic. If, for example, it's a female answering yes, it's a female, it will ask them if they're breastfeeding or pregnant. Whereas if it's a male, it won't ask you that question. And then again, you go through these questions. We do also have automated messaging, which it's also included in the pre-screener form, or rather, I'm sorry, in the IRB approval package. Again, everything that is patient facing, we like to get it IRB approved. This is essentially the web page or the landing page that we create as we kick off the campaign. Again, this is done at site level or at the sponsor level. Anywhere in the page, you're able to click, are you eligible? And this transfer you to that pre-screening form. So as they're going through the page, reading the information about the study or about the condition, they're able to click, are you eligible? That will then send them down to the pre-screener form where they will put in a zip code. Is going to give them the site that is closest to them. They're going to go next. Again, it's asking them specific information about them. It asks them if they have, again, any specific conditions related to the exclusion or exclusion criterias. Again, their sex, using the conditional logic. And then lastly, it's going to tell you that you appear you may qualify for the trial. A coordinator will like to contact you and provide the information. So once they provide the information, this is, again, where the integration with CRIO happens. So from here, we have three different integrations with CRIO. We have one that is an instant post. We have on demand or manual post. And then we have a 360 integration. So let me go ahead and change the screen actually here. Let me log out and show you this one first. So in the manual instant integration, in that case, the referral is transferred over here to TrueView, which automatically transfers the information also to CRIO. So you're able to essentially have that information that the potential participant has filled. And if they go through one of our secondary screeners, which is an additional service that we offer, essentially asking them more in-depth questions, then from there, all that information again is transferred over to CRIO. So you're able to see it and take on the life cycle of the referral from then on out. Now, let's say depending on the CRIO, not integration or rather version that you have, if you aren't able to do, or if you need any automatic communications and then you want to transfer over that life cycle, maybe once they've become a subject, then you can go ahead and utilize TrueView, which is this platform that I'm about to show you, and then fill out that information, schedule the referral, and now send that information over to CRIO doing it manually. So you could do it either way. And then lastly, our third integration is a calendar integration, which is our calendar sync, as we call it. And in that calendar sync, at any given time, any information that is populated into our system is populated into CRIO, especially if you're a site that has individuals that are just scheduling or very early in the referral stages working with that referral. It may be useful because the coordinator, once they receive the information in CRIO, they already have that initial visit scheduled and all that information is ready to go. So jumping into what TrueView looks like and its capabilities. So on the top right hand, you have essentially what we call the scoreboard, which lets you know if you have any unread emails, text messages, any new referrals, any callbacks, or any updates that you need to do on visits. Again, all of this information is transferred over to CRIO. So if you want to do any of these actions in CRIO, you can. If you want to do them in TrueView, you can. And again, once the coordinator is taking action or in that initial visit, they're able to make their notes or go off of CRIO. So let's take a look at Lady Gaga here. On the left-hand side, you have all of the referral information. You're able to directly make calls from the system. You're able to send text messages or listen to any voicemails, as well as send emails. So as let's say the coordinator or the individual that will be scheduling is going to reach out to this initial referral, they will be able to go ahead. Let's say that they just got this new referral and they're reaching out. It's unlikely that the potential referral is answering that first call. I mean, we all screen our calls. I usually don't answer a number that I don't know. So once they click left voicemail, send email, SMS, and callback, and click save, what this is going to do is it's going to send them an email, send them a text message, and schedule a callback in 72 hours. And by doing so, it's going to send them an email saying, hey, this is so and so calling you from the name of the site. Please reach us back at this number. This is regarding a study that you filled out XYZ information for. You may qualify for whatever the compensation is. And then it'll give you the information of the site. And this is site specific. So you'll be able to send them that text message, that email, and then schedule that callback. That way it's like land, air, and sea. They're able to, if they don't see the text message, they see the email. And obviously you left them the voicemail. So they're getting three forms of communication. If you leave a second voicemail, we're just scheduling a callback. And then same thing for a third voicemail. We feel like if you're reaching out to a potential referral three times over a 1 week period and they're not responding to you, that's probably not a referral you really want in your study because they're going to be inconsistent. Um, All the other options that you see here, schedule callback, not interested, excluded, they're kind of self-explanatory. We are integrated with health information exchange. So if you need medical records, you're able to pull them directly from here. And again, all of this information is transferred over to CRIO. Once you schedule them, let's go ahead and click scheduled here. So once you schedule the potential participant, let's schedule them for Friday at noon. Oops, let's do actually Friday at 2 p.m. We are also integrated with Lyft, so you're able to directly provide transportation from the system itself. We put in an address there. Let's say we'll pick them up 20 minutes ahead of time. It lets them know that it's about a 14-minute drive. So 20 minutes so it can buy them some time. Let's click next. Now, this will let you know the likelihood of a driver being available, the cost of the ride, and whether the site is paying for this yourself or you have the sponsor that's covering for this. This is a seamless way that it will allow, again, the first person that's making a contact with the referral to schedule that initial visit and get them up and going. You don't have to necessarily worry about anything else if they miss the ride or if they don't have a reliable transportation. You can do it directly from here. Once they have been scheduled, now let's go ahead and schedule them without the ride. Let's go ahead and do Friday again at 2 p.m. So now once they have been scheduled, our system will automatically update. And let's go to all referrals here. And it will show that they're ready for a screening visit. Again, all of this information is transferred over to CRIO. If you're doing any of these steps in CRIO and for whatever reason you want to come back, let's say that you want to schedule them through Lyft, through our portal, you're able to simply come back and all this information will be updated. Once they've been screened and they sign their informed consent form, it lets you know that once you transfer them over from a referral to a subject, you can revert that. And let's go ahead and let's go to subjects. And you're going to see Lady Gaga here under subjects. And again, pretty much you'll be able to schedule any future visits concurrently or in that first initial visit. If you have, let's say, a list, you're working on a study that has 15 visits or 10 visits, you'll be able to select them from the dropdown. You'll be able to schedule them. And again, all of this information transferred over to CRIO in real time, and you don't have to worry about putting information into different systems or using the systems. Usually from this point onward is when we see the drop off in participants that are using both TrueView and CRIO continue now moving forward to use CRIO. I mean, there's really, in terms of capabilities, there's nothing else in TrueView that you would have to do. Everything else you can go ahead and take it over from CRIO, but that's pretty much it. I don't want to drag it on, but yeah, it's pretty straightforward. We use it at our sister company that's a sidearm of ours, and we have a site network in the Tampa St. Pete area. And this is kind of like how Truvy came about. So we think of sites first. But yeah, open to any questions, or if you'd like a full demo of the platform, I'd be more than happy to show that as well.
Thank you so much, Johnny. Again, if you'd like to find Accelerate in the CRIO partner directory, their listing will be in there under the recruitment services. You can feel free to submit an inquiry to them if you have any. So thank you so much, Johnny.